What's interesting about this, some would wonder, well, what's up with Stafford County? Why is that? Well, it's right adjacent to Northern Virginia, which seems to be, at least this part of the state's epicenter for this disease. And remember, this is a person-to-person transmitted disease, so it's not this monster that's going to crawl through the night and somehow get you. It's transmitted from person to person. And so that individual who's ill coughs or sneezes and transmits those viruses through what are called respiratory droplets to the next individual through the air. Studies have shown that if you're at a distance of 6 feet or more, you're probably okay. Also, you remember that it's contact surfaces that this disease is transmitted by. So on your hands, touching a surface, the next person who comes along, for example, on a doorknob, touches the doorknob, they pick up hundreds, maybe thousands of viruses and then touch their hand, mucous membranes, mouth, nose, and they may contract the disease. Another interesting thing about this is that we're seeing a rise in cases already. Mike already noted that we expect this to continue to rise till March, April, May. We started out a couple of weeks ago seeing 1 or 2 cases a week. Then, 1 or 2 cases a day. Then it came to 3 cases a day. We've had 8 new cases in the last 24 hours reported to us in this health district. So we're on that upslope. That's going to continue to rise probably for the next several weeks. And then hopefully it'll plateau off and we'll start seeing that come down. One of the ways we're going to continue to count the cases, one of the ways we determine whether people can go back to work, go back to church, start hugging your grandmother again, is once those ICU admissions start dropping off, the number of cases start dropping off, we may be able to ease off. That's going to be a governor's decision, of course. We know out of these total cases I just reported to you, 18 have been hospitalized, 27 have not been hospitalized. So we know from the data that 80% of these cases are mild to moderate disease and can handle it okay at home. But I'm telling you, this is a bad disease. I walked through the emergency room today and visited the ICU, spoke to the physicians in both centers here at Mary Washington Healthcare. I was impressed, first of all, with the professional demeanor of the staff, but also the seriousness that they take this disease. And this is different than the flu or the inflammatory process that you get with the flu virus. This virus can really take you down. And I'm talking about primarily those who are elderly and those with underlying debilitating disease, such as diabetes, heart disease, chronic pulmonary disease, liver, kidney disease. Those folks need to be staying at home for sure. Ill folks, stay away from them. And those folks, elderly and those with chronic debilitating disease, stay away from sick folks. This is a serious disease. So I wanted to also then just mention what we are doing as your public health department. And I'm talking about these jurisdictions that I just listed. First of all, we do have a call center. And if we would show the call center number, I appreciate that. We have a group of primarily nursing staff who understand this disease, understand the resources in the community, and are quite willing to take your calls and offer advice and guidance.